Well, the virus has been an unprecedented test for politicians around the globe. Jeremy Corbyn is the outgoing British Labour Party leader and the leader of the opposition. He joins me now from London via Skype. Good to have you with us on the News Hour, Mr Corbyn. Just first of all, how would you rate the British government's response to this crisis?
Very poor and very slow. They have not undertaken the testing they should have done, and indeed 3 weeks ago the Prime Minister told me they were going to dramatically increase the amount of testing. It hasn't yet got to even 10,000 a day, when obviously the numbers needed are huge. And secondly, the lack of personal protective equipment all across the National Health Service and the care sector is absolutely serious. A friend went to see somebody in hospital yesterday, and she told me that the people coming in with patients were better equipped than the NHS staff in the hospital itself. We have had a government that has not done enough to get on top of this crisis. And I do hope that the Health Secretary is correct when he says he's going to get to 100,000 tests, but he's got to move very fast, and that means mobilising all resources to do that.
Well, what resources do you think the government has not been mobilising then? It sounds like you think they've been deliberately dragging their feet. What would you have done differently?
There are many test facilities around the country that can be used in universities, in colleges, in the private sector companies, and many others that could and should have been used. And it's an approach the government took that somehow or other they didn't think testing was very important, even when the World Health Organization had said the crucial thing to do was test, test, test. Because unless they do that, it's impossible to know the extent of coronavirus amongst the population as a whole. What we're doing is identifying it on the basis of people's self-analysis. Well, they're probably right. They might not always be right, but we need to know exactly how serious the problem is. And it is obviously getting very serious indeed.
And it has been getting serious for several weeks now. But what the government would say and have been saying is there isn't a global demand for all these testing products. There's a global demand for equipment, and it's not easy to get your hands on the kit that everybody needs. Do you not accept that this is a global challenge which all governments are trying to rise to, and they're doing the best they can in very challenging circumstances?
Of course it's a global problem. I fully appreciate that. We also have considerable manufacturing facilities in Britain that could and should have been mobilised much earlier for making the necessary equipment. But we also have had 10 years of austerity, meaning that our hospitals were 94% occupied before coronavirus came and hit us. And whilst the work done by the NHS and NHS staff has been absolutely heroic, I think there's a big lesson here that you cut public expenditure and underfund health services at your peril, as economies around the world are finding at the present time. This coronavirus crisis is exposing an awful lot of economic mistakes that have been made, but also exposing, as your programmes have often done, the terrible health inequalities that exist around the world and actually threaten all of us because of that.
Well, you touch on that, Mr Corbyn. Much has been made in recent days of the fact that this is a virus which doesn't respect borders. It doesn't care who you are or where you are. Given this, what do you make of the collective response to this crisis, which appears to be characterised by people not working together instead of working together?
Well, the characteristic of it is that the populations as a whole are alarmed. Governments around the world have said people must stay home and not go to work. Therefore, the economies are obviously in great difficulty. And the packages being prepared by various governments, including the British government, to support people that have lost their jobs have often been inadequate, particularly among self-employed people. And so there are huge demands and pressures that we are making as an opposition on the government to improve that package and support people, and also get ready for the future, when I hope we're going to have an investment-led economy, not a period of retrenchment after the coronavirus. But I just want to say that this Al Jazeera reports on the issues around the world have also been very important, because if the people stuck in refugee camps in Bangladesh, in the Middle East, in North Africa, are not protected in some way, not given the support they need, then coronavirus could spread very, very rapidly. And it's impossible to practice social distancing in those kind of situations. And so the call made by former British Prime Minister Gordon Brown for a global approach to this, a World Bank approach to this, and a Group of Seven approach to this is, I think, a very important one, so that we actually do recognise that the health inequalities around the world are actually putting us all at risk.
Quite, but given the struggles that we see developed countries like the UK and the US, and indeed Italy, given the struggles that these countries are facing, where do you think the help and support should be coming from? Because countries worldwide are showing that they're all struggling to get on top of this crisis. Countries worldwide are showing that they need to sort out their own backyard first before they start donating aid overseas. So where does the solution to this crisis lie?
The world's institutions are the ones that have got to step up on this as well, and obviously their contributors are the governments of the world. So you're talking here the G20, you're talking here the International Monetary Fund and World Bank. They've all got to be part of this, because surely the lesson is that we're all at risk from this virus. And I think the heroism of people doing their best to try to stop the spread of coronavirus and treating people when they themselves are being put at risk because of it, and indeed in some cases dying because they've been treating people, is something that we should all obviously admire, but recognise that this is a desperate battle. Let's make sure we win it, but also let's make sure we recognise what brought it about in the first place.
OK, Jeremy Corbyn, the outgoing leader of the Labour Party, thank you very much indeed for speaking to us here on Al Jazeera.
You're very welcome. Thank you.